You're very welcome to our very first Facebook Live on Compass Media. Compass Media is a new platform that has been set up by myself and Dr. Finbar Markey to bring you news and commentary that you won't find in mainstream media. And I'm here, it's late on Saturday evening, and I have been attending the Irish Nurses for Freedom and Openness conference that has been taking place all day in Athlone. And I have to say that even though it's late in the evening and I've been at the conference all day, I'm actually very, very energised by what I heard today, and also very energised by the many, many people that I met. And I'm going to chat now to Paddy Hennessy, who is the PRO for the INFTO. Paddy, I hope I got the name right in the introduction today.
You did almost. So the Irish Nurses for Transparency and Openness.
Yes. So Paddy, you and I met a number of weeks ago when the INFTO held a press briefing with the rural independent TDs led by Matty McGrath. And I have to say that there were a number of nurses and healthcare workers present at that meeting that day that shared their stories with the TDs. But today it was a very large gathering, and quite a number of the delegates present spoke about their personal experience in the hospitals and residential care homes and nursing homes where they're employed. And some of the stories really were quite shocking.
Yeah, and I suppose probably just to pick up on the Irish Nurses for Transparency and Openness, people assume that we are all nurses, but actually we come from the entire spectrum of healthcare workers. We are largely based of nurses, midwives, but we also have doctors, physiotherapists, social care workers, etc. There was a great energy at the INFTO conference today. I think it's hugely important that we arranged a face-to-face meeting. Obviously, in this new modern world, Zoom can only do so much. And I think it was important for healthcare workers to come together, to feel that sense of empowerment amongst each other, and also to feel like that they're not isolated. They came from the four corners of Ireland.
Yes.
They came, with fire in their bellies. Many of these, as we've mentioned and highlighted with the TDs, are being discriminated against, being harassed on a sometimes daily basis. They're very concerned about many different issues that are happening within our hospitals and healthcare institutions. So today was a very empowering and powerful discussion, and gave us the opportunity to discuss those things in further detail, and also to formulate actions and solutions, I guess, really to the problems that we're seeing. The afternoon part of the conference was joined, as you know, by a doctor, and also by a lawyer, who again gave their input and advice and support to the many people who travelled here today.
Well, just to pick up on that point with regard to the doctor, and this doctor is he's a GP. People are not familiar with him. He's not one of the number of doctors who have come out very publicly and spoken about vaccines and lockdown and all of that. This man would not be known to any of us. In fact, it was my first time to see him. And I suppose one of the most shocking things that I heard him say is that he is now in a position where he has to go onto an encrypted platform to discuss medical matters with other GPs, because if he and the other GPs were found to be sharing information about what is actually happening, they would actually be bringing the full wrath of the Irish Medical Organisation down upon them. And that is what they feel, that is what their perception is. And he did say that his experience, the first 50 people that he vaccinated at the start of the year, 14 of them ended up in hospital very, very ill. And he pointed out that it was very interesting that that particular 14 group of people actually received a vaccine from the same batch. So he pointed out that there are different batches and different vaccines and so on. And but this is not being picked up on. And if you speak out about it, you are being termed an anti-vaxxer or a conspiracy theorist. So he feels that a lot of GPs and medical people are being driven underground because they're afraid of speaking out in public.
Most definitely, and I think that's right across the healthcare spectrum, that there is active and inactive silencing of people. So again, anyone who does have the courage and bravery to question some of the policies and practices, are immediately labelled as misinformation givers, anti-vaxxers. There's a plethora of labels that they use to try and, I suppose, box healthcare workers and I guess weaponise the terms and use it against them to, discredit really what they're saying. I think, and we mentioned this at the conference today too, I mean, it's incredible. This has happened around the globe. This is not just in Ireland, where medical professionals, nursing professionals, registered healthcare professionals are having to use encrypted platforms to discuss, very serious and worrying issues that should be able to be discussed on an open public forum. We mentioned to our members today that we have been contacted by an International World Council for Health, who again have had to organise themselves with the intention of giving a platform to any groups in particular who have been silenced or been labelled as misinformation givers. So it really is, I suppose, a worrying sign of the times that we have to put those structures in place in order to have the information that that we're discussing, actually to have a platform to share that information. But I suppose to look at the positive side of things, it's just wonderful, I think, to have people who are asking questions, who are questioning some of the policies and procedures that are being implemented widespread across our health service and healthcare institutions, to have those come together. People of like mind, to share stories, but also to have debate amongst ourselves. It's not that we're all singing from the same hymn sheet here.
Yes.
There is debate, as you see.
I saw that today. There wasn't unanimity. People did say, well, I'm sorry, I agreed with what you had to say there, but I cannot agree with you on that. So, yes, there was definitely a healthy debate going on, and that was fantastic. I suppose one of the issues that was raised today was the failure of mainstream media to actually report on what is actually happening. So maybe briefly you might just tell us about INFTO's difficulty in getting mainstream media to actually publish the material that you've brought to them.
Absolutely. So going back as early as July of this year, 6 whistleblower nurses and healthcare workers told their stories to various well-known media organisations. To date, those stories remain unpublished. I think it's quite incredible that the information that is contained within those stories very much needs to be in the public domain. As spokesperson for the INFTO group, I've had my own interactions and experience with mainstream media, with journalists, with newspaper editors. And, again, if we go back to the labels, if you were talking about anything that is, anti what the traditional narrative or the mainstream narrative is, you immediately become a target, and you are... There is an attempt to again discredit what you were saying by attributing to one of those labels. So as people, or your viewers may or may not know, we have had 2 articles published in mainstream media, one being in the Sunday Independent. And again, the headline for the article is "Nurses Group Denies Anti-Vax Status but Do Have Genuine Concerns." Now, I think we need to focus more on the concerns. And certainly, as you would have seen from the conference today, people, the nurses and healthcare workers here are extremely concerned about the quality of care, the lack of basic even patient care needs within our hospitals, and also around the lack of discussion. So we have attempted to bring this information to light in various different streams. We have contacted our elected politicians. Some of them have very graciously agreed to meet with us and hear our stories. But we also have contacted every single media organisation in Ireland. And again, there seems to be a clear attempt to just label our group as having some sort of anti-vax agenda, which is not the case. Certainly, you know, that is one of our priorities in terms of suspected vaccine-related injuries. However, we have many other pressing concerns that most definitely, again, need to be in the public domain. So it's quite shocking, I think, that you know, the traditional outlets that we would use to highlight this information, again, so that action can be taken, have failed us. And I think that's the only way they can put it. They are failing us as healthcare workers, but they're also failing the people of Ireland, because they do have a duty to report on the events that we are reporting to them.
And in actual fact, as you know, there was a mainstream journalist here today who spoke from the floor, saying that while she works in the mainstream media, the stories that she has written around this whole area of what is actually happening in the hospitals and so on has failed to be published. So sometimes people are inclined to demonise journalists and blame them for what's happening because of the lack of information in mainstream media. But in actual fact, there are some fantastic journalists out there who are trying to get that, you know, get these stories printed and published, but they're being stonewalled by the editorial boards of the various papers and possibly the producers of the various mainstream media programs. So, Paddy, I'm very conscious of the fact that it has been a very, very long day for you, because you were here hours ahead of everybody else, and you know, you chaired the various meetings and you've been meeting people all day. So just before you go, Paddy, if you would just tell our viewers, I suppose, some of the very positive outcomes of the meeting, and what's, you know, there was a plan formulated today for going forward. So you might just tell us a little bit about that.
Most definitely. So again, one of the main aims of today was to build our support team, build our support network. But accountability is, you know, one of our main goals as an organisation. Compassion, transparency and accountability. They are our goals as the INFTO. And our intention is to, you know, gather the data that we need, which we already have, to be honest. We have first-hand witness testimonies. We have a plethora of information and data and research to back up exactly what the testimonies are saying. And today was about solutions and actions. You know, again, I think it's just important to highlight that these healthcare workers are exhausted, as much as we're as exhausted after today's conference. They have had 19 months of this. On top of dealing with the COVID-19 pandemic issues, they're also facing huge issues within their workplace. So they also want action taken. I would say they have fire in their bellies.
Yes.
And there was just a wonderful sense of community, I think, here today.
Yes.
And that is going to be hugely important going forward as we face the challenges coming into the winter period and beyond.
Mm-hmm. So those of you who have been watching, I'm here in Athlone with Paddy Hennessy, who is the PRO for the INFTO, Irish Nurses for Transparency and Openness. They held a conference here today, and as we've just mentioned there, there's huge difficulty in getting this information out on the mainstream media, but social media is absolutely powerful and you have your role to play in getting this information out into the public domain. So I would ask you please share this video. And just to remind you that M-Compass Media is a new platform. It has been set up by myself and Dr. Finn Markey, and we will never ask you for donations. The work that we do is entirely voluntary and unpaid, and we're very, very happy to do that. So we just ask you, please, to share the video. And until we meet again, Bannocht Day or If Galéir.